Rapid aging after 50, the overlooked role of chronic dehydration. How dehydration silently accelerates disease, fatigue, and aging, and how restoring saltwater balance can prevent suffering and support healing. Introduction. The question no one asks after the age of 50, many people experience a sudden cascade of problems. Weakness, fatigue, joint pain, poor digestion, poor sleep, anxiety, memory issues, BP, diabetes, kidney issues, eye dryness, skin aging, frequent urination, breathlessness, allergies. These appear almost together. Most people are told, this is aging, this is lifestyle, this is genetic, this is normal after 50. But a deeper question must be asked. Why does the body seem to fail as a system after 50, not organ by organ? The answer lies in a silent physiological neglect affecting almost everyone. Chronic dehydration combined with fear of salt. This lecture explains why this single neglected factor accelerates aging and disease, and how restoring basic physiology can slow the process dramatically. Part 1. What really changes after 50? After 50, thirst sensation weakens, kidney water salt regulation changes, digestive secretions reduce, physical activity declines, tea, coffee intake increases, salt is restricted due to BP fear, diuretics and BP drugs are common. The most dangerous change is this: the body stops asking clearly for water. Thirst disappears, but dehydration continues silently. People live for years in chronic low-grade dehydration, mistaking symptoms for aging. Part 2. Dehydration puts the body into survival mode. Water maintains blood volume, circulation, oxygen delivery. When water is low, blood thickens, oxygen delivery reduces, microcirculation suffers, the body activates, sympathetic nervous system, cortisol, RAS, renin-angiotensin-aldosterone system. A body in survival mode cannot heal, repair, or regenerate. This is why aging accelerates. Part 3. Digestion, salt and water, the gateway that fails first. Most people say, I eat well, but feel weak. Supplements don't help. I feel bloated, constipated. Digestion is fluid dependent. Saliva, gastric juice, bile, pancreatic enzymes, all are water-based. Chronic dehydration causes reduced saliva, low gastric juice, poor bile flow, sluggish intestines. Salt is essential for hydrochloric acid, chloride source, protein digestion, mineral absorption, iron, calcium, B12, zinc. Low salt plus dehydration leads to low stomach acid, poor digestion, anemia, muscle loss, bone loss. A dry gut cannot nourish the body. Warm water supports digestion. Cold water suppresses it. If digestion fails, nutrition fails, medicine fails, healing fails. Part 4. Why warm salt water is different. Warm water improves absorption and circulation, activates parasympathetic vagal nervous system, sends a safety signal to the brain, salt, allows water to enter cells, maintains blood volume, stabilizes nerves and muscles. Water alone is not enough. Salt is required for cellular hydration. Natural salt, rock, Himalayan, sea salt, is preferred for biocompatibility. Part 5. General weakness after 50. Muscles are 75% water. Dehydration causes poor muscle contraction, reduced ATP, energy, poor oxygen delivery. This causes constant weakness, easy fatigue, poor exercise tolerance, often mistaken as old age. Part 6. Joints and cartilage. Cartilage is 70–80% water. Salt creates osmotic pressure that pulls water into cartilage, maintains cushioning, allows smooth movement. Dehydration dries cartilage, friction increases, pain worsens. Painkillers reduce pain. They do not restore hydration. Part 7. Heart muscle and circulation. The heart is a muscle, an electrical organ. Electrical impulses require water, medium, sodium, trigger. Dehydration causes thick blood, increased workload, palpitations, BP instability. Low salt increases stress hormones. A dehydrated heart works harder with less efficiency. Part 8. Brain, mind, and mental health. The brain is 75% water. Salt is essential for nerve impulses, memory, focus, emotional regulation. Dehydration causes headache, brain fog, anxiety, poor sleep, poor meditation. A calm mind needs a hydrated brain. Part 9. Eye health. Eyes depend on tear fluid, electrolyte balance, microcirculation. Dehydration causes dry eyes, burning, eye strain, poor night vision. Salt stabilizes tear film. Dry eyes are often dry bodies. Hydration supports retina, lens, optic nerve. Part 10. Skin aging. Skin is a living, water-dependent organ. Dehydration causes reduced skin circulation, poor collagen flexibility, wrinkles, sagging. Itching creams hydrate surface. Salt plus water hydrate cells. Skin ages fastest in a dry internal environment. Part 11. Kidneys and the salt myth. Healthy kidneys are designed to excrete excess salt, are stressed more by salt deficiency. Low salt plus low water activates RAS, increases kidney workload, accelerates decline. From the salt fix, salt deficiency makes kidneys work harder than salt excess in normal kidneys. Part 12. Bladder frequency paradox. Dehydration irritates bladder muscles. Proper rehydration calms smooth muscle, improves capacity, reduces frequency over time. Restricting water worsens urgency. Part 13. Asthma, allergy, and histamine. Dehydration dries airway lining, increases histamine release, increases airway reactivity. Salt supports smooth muscle control. Hydration reduces baseline sensitivity. Supportive, not replacement therapy. Part 14. Sleep requires parasympathetic dominance. Dehydration raises night cortisol, causes early awakening, causes restlessness. Warm salt water calms nervous system, improves sleep depth. Night sipping is appropriate when the body wakes you. Part 15. Diabetes and dehydration. Dehydration concentrates blood glucose, worsens insulin resistance, raises cortisol and liver glucose output. Diabetes causes dehydration. Dehydration worsens diabetes. Low salt worsens insulin resistance, kidney stress, BP variability. Dry blood makes sugar more dangerous. Part 16. Cancer risk and internal environment. Dehydration does not cause cancer directly, but promotes chronic inflammation, hypoxia, poor detoxification, weak immune surveillance. Dr. Batmangelij reported case observations of improvement after rehydration, supportive physiology, not cure. Water does not cure cancer, but dehydration supports disease. Part 17. Why this is rarely taught. Because dehydration doesn't show clearly in labs. There is no drug for hydration. Medicine treats organs, not physiology, but physiology decides outcomes. Part 18. Practical principles, non-prescriptive. For people with normal kidney and heart function, do not wait for thirst. Prefer warm or room temperature water. Add a pinch of natural salt once or twice daily. Sip slowly. Hydrate earlier in the day. Caution in advanced kidney disease, severe heart failure, salt-sensitive hypertension. Always individualize. Final conclusion. Most people are not aging faster after 50. They are slowly drying out. Hydration is not optional self-care. It is the biological permission for digestion, healing, exercise, meditation, sleep, and graceful aging. The final message. Before asking the body to heal, first ask whether it has enough water and salt to function. Thank you, Holistic Wellness Foundation, IMFAL Healing Beyond Boundaries.